The last labor and delivery stronghold in Clark County, Grove Hill Memorial Hospital will be closing its labor and delivery tomorrow. Tonight, Shelby Myers investigating why this is happening and if anything can be done to save rural labor and delivery units. It's tonight's special edition of Undeliverable, a maternal health care crisis, part 2.
It happened at Monroe County Hospital last November, and now, less than a year later, it's happening at Grove Hill Memorial Hospital. The last labor and delivery unit in West rural Alabama is shutting down. So why now? After nearly 75 years of delivering babies, I'm looking into that and what can be done now to help pregnant mothers who live in Clark County. Having a scheduled induction, driving more than an hour while in labor, or showing up to the nearest ER to deliver a baby. It's the reality pregnant women will now face after Friday, as Grove Hill Memorial Hospital is forced to close down labor and delivery.
They live here. Yeah.
In a coffee shop in Jackson, Kaylin Stewart rocks her baby boy Waylon. And she tells me without Grove Hill, she would have delivered in her car.
My immediate thought was, I'm glad I've already had him because I wouldn't have made it to Mobile. I went into labor as I was picking my daughter up at the car rider line. I got to Grove Hill a little after 2, got checked in. They checked me at about 2:20 and I had him at 2:55. So I wasn't even in labor for 2 hours with him.
Now her heart is with her pregnant friends.
I would be terrified. I would absolutely choose to get an induction just to prevent going into labor here. Because say I had a hemorrhage in Jackson or Grove Hill and there's no OB, they cannot fly you out while you're hemorrhaging.
Dr. Donald Williamson, president and CEO of the Alabama Hospital Association, says something alarming is happening at rural hospitals as a whole.
First started taking a look at this probably right around the end of COVID. And we had, I think at that time, about 15 to 17 rural hospitals at risk of closure. Now we have 24.
That's why rural hospitals like Grove Hill Memorial have claimed rural emergency hospital status. It saves the hospital, awarding it $3 million a year in federal funding, but forces it to cut services for people who would have to stay more than 24 hours. i.e. women and their newborn babies. Dr. Williamson blames multiple problems: low Medicaid reimbursement, lack of insurance, and staffing shortages.
Alabama has the lowest Medicare reimbursement rates in the country. If any business was operating and by federal law had to cover everybody who came through the door, and 1 out of 5 of those individuals who come through the door can't pay their bills, that business is not going to be in business very long.
Alabama is in the minority, one of 10 states that has not expanded Medicaid eligibility. Dr. Max Rogers is the OBGYN at Grove Hill Memorial. He says he wasn't always for the expansion.
5 years ago, I'm not sure I appreciated what Medicaid expansion could do for our state. But I can tell you now, without Medicaid expansion, we are not going to see this problem go away anytime soon. We must pass some kind of Medicaid expansion.
At 18 weeks pregnant, Jessica Overstreet agrees.
I have a conservative view on things. I'm very pro-life, very, very pro-life. And I understand why people don't want to expand Medicaid. I understand that it's taxpayer funded. I understand that there's no such thing as a free lunch. But at the end of the day, we say that we're a pro-life state. The majority of our lawmakers say that they're pro-life, but their actions in Montgomery do not say that.
Cover Alabama campaign director for Alabama Arise, Debbie Smith, is fighting for expansion.
Expansion can be done by the governor. That's the easiest route, is for Governor Ivey to use her executive authority to expand Medicaid, but the legislature can also pass a bill to expand Medicaid.
When I asked Alabama Governor Kay Ivey's spokesperson about Medicaid, she did not get back to me, but she did previously tell me that Governor Ivey thinks a pilot program to allow county health departments to host checkups for pregnant women can help. But some I spoke with say it still doesn't address the need for a place to deliver in rural areas. A conservative-leaning group, the Alabama Policy Institute, says Medicaid expansion isn't the answer, sending me this statement that reads in part, quote, "The finger-pointing regarding Medicaid expansion is mostly political and disingenuous. We believe that state-controlled authorization for medical facilities through the Certificate of Need process is antiquated and impedes free market solutions to maternity care issues. Rural areas should be exempted from the con process to satisfy the immediate need." Two doctors at the University of Alabama at Birmingham offer some initiatives they say could help.
Aware of a lot of work that's going on around this right now at the state level, at the local level, that people are really trying hard to find solutions, creative solutions to make things better.
Dr. Candace Knight is the director of the Nurse Family Partnership. They received an $8.8 million grant to increase maternity care access to rural places like Grove Hill. Their goal is to eventually integrate a nurse midwife in Clark and Washington County around 2025. Dr. Martha Wingate at UAB is over the Alabama Maternal Health Task Force. Her goal is to educate first responders on delivering babies.
Labor and delivery may be kind of scary because they know how to deliver babies, but beyond that, certainly making sure that there's a recognition and kind of those basic skills of, if a mom comes in and she's hemorrhaging, what do we do? If a mom comes in and we see that her blood pressure is high, what do we do?
While it's a start, Overstreet says much of it still falls short for her.
Something needs to change. We shouldn't have to keep just toughening up and doing what we got to do.
If you are pregnant or hope to get pregnant and you have limited access to health care, I have some information on some of these initiatives and more on our website, fox10tv.com. Some potential promising legislation at the federal level could be on its way. A bipartisan bill to allow these rural emergency hospitals to keep obstetrics has been introduced. Until then, women in Clark County will officially have to drive an hour or more to deliver after tomorrow, when those services end in Grove Hill. For Fox 10 News, I'm Shelby Myers.
Now we reached out to Katie Britt about the healthcare desert now in southwest Alabama, and her officer sent this quote. Ensuring expecting moms have access to labor and delivery services is key to ensuring both their health and their baby's health. I am working with colleagues on both sides of the aisle to enact legislative solutions, including the Rural Emergency Hospital Designation Improvement Act, Rural Obstetrics Readiness Act, and the NIH Improve Act. This is to ensure women, children, and families across Alabama and America have access to the care they need to thrive.